All right, you guys, I was going to make this into 3 separate lectures, but I'm going to do 2. I did shorten part of this nursing staffing section, so I thought it would fit fine in 2 lectures. So let's talk about nursing staffing. Staffing is ensuring that the appropriate number and mix of healthcare workers are available to meet the needs of the patients and to provide safe, effective care. It's going to be individualized per department. So if you think about staffing in the ICU, it's definitely going to be different than staffing on a medical unit because it all depends on the complexity of the patient care. So charge nurses need to take many things into consideration before they staff the unit. Those things are like, what are the medical needs of a patient? What experience level is the staff at? Are there confused patients they need to worry about? And is the geographic location okay with the nursing assignment? Patient classification system categorizes patients according to specific criteria needs, and this is what the charge nurses use a lot of times. The higher the acuity, obviously, the more intense the registered nurse needs are going to be. And a lot of times they'll use hours per patient day. So let's talk about the number of hours. This is the number of hours permitted or allowed for a registered nurse to spend with a patient per 24 hours. And it's calculated by the census per the unit. So an example is if a unit census has 25 patients with hours per patient day of 7. You take 7 hours times the 25 patients, and that's going to leave you with 175 hours of nursing care to staff the unit for the day. They also have to take in consideration the budgeting, and in some organizations nurses can be mandated to stay over their scheduled hours, or they use AWOPing to implement if the unit is overstaffed. So click on pause and take just a few minutes to answer these questions, and then we're going to move on to the next category. After we talked about JCAHO, JCAHO is the Joint Commission on the Accreditation of Healthcare Organizations, and it uses a tracer methodology for identifying continuous quality improvement items and overall patient safety. Think about how you personally can help ensure quality of care and how the charge nurses have to take this into consideration when they're thinking about staffing the unit for the day. Alright, so now let's talk about managing and promoting change. This is a huge issue. Change is going to be more accepted and it's going to have better success when it's properly planned and implemented. Too many changes can be difficult for staff to deal with, and it certainly can lead to doubt by the employees because people often resist change. But you have to remember that change is inevitable in healthcare and constant. There's always resistance to change. People may have to adopt new practices and they're not comfortable with doing that. So there's typically 3 types of people when dealing with change. Those that resist change, mostly because they may feel threatened by that change. There are those that accept change, and those that are fence sitters because they watch and react to the others around them instead of being one of the first 2. The electronic medical record was a huge change, and there was much resistance to that. How can we decrease resistance? Basically, it's plan, 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 and communicate, communicate, communicate. You yourself can be a change agent, and that's someone that the staff can trust, and it's someone who motivates people to be able to see the benefits of the change. And especially as a new nurse, that could be something you could do. So again, click on pause and take a few minutes to answer these questions. Healthcare is constantly changing, and to help other staff members and families adapt to the change, the nurse has to set the example for that. You have to be the leader in change. It's necessary to identify the forces that will assist and the forces that will act against the change. This is completed by identifying the driving and restraining forces. Typically, driving forces must be greater than the restraining forces, or the driving forces have to have a greater impact than that of the restraining forces. Each person and organization undergoing change must pass through these changes for it to be successful. And they are unfreezing, moving or changing, and refreezing. So let's talk about those a little bit more. Unfreezing is about getting ready to change. It involves getting to a point of understanding that the change is necessary and getting ready to move away from the current comfort zone. People must first believe that improvement is possible before they're willing to even consider the change. And oftentimes the unfreezing phase will make people anxious or uncomfortable. There are forces to consider when there's a change. Driving forces are the forces that assist the change to occur, and restraining forces are the forces that will prevent the change. As a newer nurse, you should clarify and understand what the new change is and how it's going to affect the care that you give. The moving or changing phase is when the driving forces prevail. This is a list of the change agent responsibilities. If refreezing is not completed, people may drift back to their old habits. The responsibilities of change agent are to require and enforce compliance with the change process, support and encourage people, follow up as needed, and reevaluate as needed so that refreezing can take place. Alright, for the last part of this lecture, click and pause and take a few minutes to think about this case study. And what you should think about is, what is the problem? What is the potential change needed? What are the driving and restraining forces? And then think about those 3 phases that people would have to go through for that. And then that's the end of this lecture.